Thank the gentleman. The gentleman from Pennsylvania, Mr. Smucker, is recognized to inquire.
Thank you, Mr. Chairman. I'd like to thank all of the witnesses for testifying here today. COVID-19, as has been talked about, has certainly exacerbated the mental health challenges faced by our children. And of course, that's why we're here today. And I appreciate the chairman scheduling this hearing. I am concerned that some of the responses taken to combat COVID-19 in schools, while perhaps well-intentioned, may have made the problem worse and not better. Despite almost $125 billion spent in the American Rescue Plan Act last year to keep schools open, and President Biden's vow to keep schools open, many schools closed again this winter amid Omicron outbreaks. And I was chair of the Education Committee in the State Senate in Pennsylvania. One of the things we worked with with our school superintendents was to combat what we call the summer slide, or the summer loss of learning that students tend to experience. And by the way, particularly students who are historically disadvantaged student groups see the most impact from not being in an education setting. And so, teachers we've known this for a while, teachers noticed that students coming to the school in the fall had lost, were at a different academic level than when they had left before the summer. And so looking for ways to combat that. So I'm very, very concerned about the long-term impact on students of the loss of learning from schools that had been closed on and off over the last 2 years. And then certainly we need to also address a child's mental health needs while they are in school. And I particularly want to talk about masks. I know that's been brought up earlier several times in this hearing. But I was pleased to see in Pennsylvania, the Pennsylvania Supreme Court threw out Governor Wolf's statewide mask mandate for schools earlier this month. And the reason I'm pleased with that is because, first of all, the data of the effectiveness of mask wearing in schools is not in question. Is in question, I should say. There's not a body of evidence that supports that mask wearing in schools for students is effective. And to that point, Mr. Chairman, I would like to submit for the record an Atlantic article that was published last week, published on January 26th, titled "The Case Against Masks at School." I think you should have that at your desk.
So ordered.
Thank you. So again, it's titled "The Case Against Masks at School." The subtitle says, "Districts should rethink imposing on millions of children an intervention that provides little discernible benefit." And this is authored, by the way, by an infectious disease scientist, by a faculty member at the Portland State University School of Public Health, and by a doctor at UCSF. And they point out in the article just a few things I'd like to point out. I think it's a pretty good synopsis of what we know about mask mandates so far. But they point out, as I mentioned earlier, that there's little conclusive evidence that masking in schools reduces COVID-19 transmission, but points out that mask requirements in schools do come with risks. And I feel we don't balance enough some of the risk with the mitigation efforts compared to the risk of COVID. For example, they say requiring masks may impede children's hearing communication, their language and speech development, and their emotional recognition. Furthermore, masking presents even more drastic challenges for children with learning disabilities. Other countries, like the UK, Denmark, have caught on to this, by the way. The World Health Organization guidance urges that children under 5 and children with developmental disabilities not be required to wear masks, and that masking decisions for children should take into account children's psychosocial needs and development milestones. And alternatively, here in the US, the CDC guidance recommends that all children age 2 and older wear masks without any nuance or any acknowledgement of the potential risk that masks pose for children. So, just my sense that masking decisions should take into account the overall well-being of children. And as we've seen throughout the pandemic, I think a one-size-fits-all approach rarely works. So, Ms. Uvala, I know you've spoken to this previously, but how have school closings impacted the mental well-being of children? And what challenges do masks bear on children's learning and development?
Sure. So school closings, I think, have impacted considerably the mental wellness of children. As I mentioned earlier, I think young children, particularly adolescents, they really crave socializing, and it's part of their growth and development. I think for us, if we think about adults, if you went from age 37 to 39 or 41 to 43, that's not that big a difference. But if you left in the 6th grade and returned back in the 8th grade, or in kindergarten and return in 2nd grade, that's a huge difference in a child's life. And those years are very, very important. And then children will have a consequence to that. I think it's very important to consider whether you're considering masking or other mitigation strategies. I think all of it has to be balanced with overall wellness for sure.
Do you think that policymakers have appropriately balanced the risk of COVID-19 with the negative impacts of school closures and masking?
I think that there definitely needs to be more consideration. I think there are some policymakers that have and that have had behavioral health people at the table. I think that's also very important. It's who you have at the table making these decisions and considering all aspects. I think some policymakers have. I think across the board, can we say that this has been, balanced? I don't think that we can say that. And I do agree that in 2020, when this first came about, maybe there was a need at that time to do certain things because it was just so new. We are in a different place now, and I do think this warrants more conversation about balance.
Thank you.